Hello, my name is Hannah Garcia, and I am a peer health educator with the Office of BroncoFit at Boise State University. I will be speaking on intersex awareness and the impact that it has on individuals and the healthcare system. What does it mean to be intersex? According to the Boise State Gender Equity Center, an intersex individual is defined as a person born with biological characteristics, anatomy, chromosomes, and/or hormones that exist outside of the current system of sex assignment. Someone who identifies with their sex assigned at birth is considered a cisgender individual. Traditionally, it is seen that gender is fluid and on a spectrum, while sex is black and white. However, that is untrue. Biological sex is on a spectrum as well, as some people have outward presenting genitalia that do not match their inside sex organs, gonads, and more. This strays from how we normally assign sex at birth, which is simply based on outward genitalia alone. It is important to note that intersex is an umbrella term. There are many different biological factors that can contribute to someone being intersex. Because of these biological factors and differences, we cannot and should not assume that someone's outward genitalia is indicative of their biological sex. While the term intersex is broad, there are a few common biological factors we can learn about. The first would be congenital adrenal hyperplasia characterized by XX chromosomes. This is an umbrella group of genetic conditions that limit hormone production in the adrenal glands. While ambiguous genitalia may be present, it is no cause of concern, as the majority of people with this condition will live normal, healthy lives. Next would be a partial or complete androgen insensitivity, which is characterized by XY chromosomes. This insensitivity can affect the development of a male fetus and can make individuals unable to properly respond to sex hormones. In certain cases, removal of the testes may be necessary, as testicular cancer is a risk associated with this syndrome. Lastly would be Klinefelter syndrome, meaning someone has XXY chromosomes. There are no obvious signs or symptoms present with this biological factor. According to data from the United Nations, about 1.7% of babies born are born intersex, which is over 70 million people. While this seems low, we can put it into perspective. Redheads make up between 1 and 2% of the world's population. Additionally, identical twins make up about 0.3% of the population. If you know someone who is a redhead, and if you know someone who's an identical twin, chances are you know someone who is intersex as well. There are more intersex people than we may think, which is why spreading awareness is incredibly important. I'd like to take a moment to highlight a notable intersex figure. This is Castor, a South African 800-meter Olympian. Castor is a female-identifying intersex individual. Due to recent 2018 testosterone regulations, Castor is deemed ineligible to compete due to the supposed unfair advantages that her naturally high testosterone levels may bring. She had the option to take medications to lower her testosterone levels, but Semenya refused. She believes that professional athletes should be free from any performance-altering substance, including those that would lower her testosterone levels. Because of this, Semenya is ineligible to compete for the foreseeable future. So, why does this all matter? First and foremost, there is a vast knowledge gap that exists for a lot of people. For starters, many people believe that being intersex is a condition that needs to be corrected. Additionally, people think being intersex is extremely rare and that intersex is synonymous with transgender. These are all false narratives. Intersex is not a condition that needs to be fixed. While gender confirming surgeries can help some individuals feel comfortable in their bodies, oftentimes these surgeries are by no means medically necessary. Teaching future healthcare professionals about these individuals can ensure that they are giving equitable care to each and every future patient. As a current or future healthcare professional, it is of paramount of importance to learn about intersex folks the same way we learn about cisgender males and females. Intersex people deserve to have healthcare practitioners who are knowledgeable and can tend to their unique needs. Another large issue in the intersex community has to do with non-consensual genitalia procedures. According to information from Interact, all but 2 hospitals in the United States still perform infant genital surgeries. In general, being intersex is not of concern, and in most cases does not require surgical intervention. While it is valid for one to request a gender-conforming surgery, it should be done when the individual is old enough to consent for themselves. This is unfortunately not the reality. Most intersex surgeries are done when the person is under the age of 2. While physicians may claim that gender binary surgeries are medically necessary all of the time, we know that only certain situations indicate the need for immediate medical intervention. Everything else can wait until the person is old enough to make an informed decision about their own body. When these surgeries are done without the patient's informed consent, the United Nations considers it a human rights violation. This issue has reached the medical governing body, the American Medical Association, also known as the AMA. As of 2021, their guidance suggests that male and female sex markers should be removed on birth certificates. As we know, those markers are based on outward genitalia only. No further genetic or hormone testing is done to confirm one's gender identity or sex. This can lead to adverse effects in the future if people assigned sex at birth is not completely accurate. What can we do about this? By reducing the stigma, spreading awareness, and advocating for others, we can be better advocates for bodily autonomy and for human rights. We can normalize intersex identities and be educated on what intersex means and how it can impact someone or others. By spreading awareness, we can use our voice to make positive change. By adjusting our binary language, we can foster a more inclusive environment for all. Challenging our predisposed idea of what constitutes male or female is a necessary step in unlearning previously harmful thoughts or biases. We can advocate for others by uplifting the voices of intersex people, including athletes like Castor. Interact has What We Wish brochures that highlight some of the things they wish their parents, teachers, friends, etc. knew about their intersex identity. If you are interested in more resources about intersex individuals, please visit the Boise State Gender Equity Center, Interact, or Planned Parenthood for more information. Thank you so much for watching, and if you would like an extended resource matrix, please contact wellness@boisestate.edu. Thank you.